902. Let's go over to the phones right now where Mary Rhodes from the Guam Hotel and Restaurant Association is on the line. Good morning, Mary.
Hi, good morning.
I haven't heard from you in a bit. First of all, I just want to rewind. How was your Easter?
Oh, we've been working every day, so although everybody was having time with the family, I was able to call people and wish them happy Easter.
Okay. We wanted to talk to you about the latest with the sailors that are in quarantine. I know when we last spoke, we were talking about how the agreement, I believe it was with the Department of Defense, that the government was going to be housing 3,000 to 3,500 sailors in quarantine hotels. And I noticed that it's now 4,021 sailors have moved ashore. Are we still at that 3,500 limit?
At 4,200 is actually
21.
shared between Navy Base Guam and the hotels.
Okay.
Prior to engaging with the hotels, they already had several individuals in different facilities on base.
Mm-hmm.
And so really outside in the hotels, we have about 3,300.
Oh, okay. And let's go ahead and move on to the this program. I just noticed it on one of the GHRA releases about the unified outreach efforts for the business community. It's an effort between GVB, GHRA, and the Chamber of Commerce.
Yes, as you guys know, you were the first one to interview me on the outreach efforts we've been doing with our business community with regards to not just the SBA loan, but also any of the rapid response and Hire Guam programs, and now with the unemployment benefit that has been created through additional funding with Guam Department of Labor and U.S. Department of Labor. So we started that process maybe about 4 or 5 weeks ago, and so it's taken us some time to get some movement with those numbers and getting that outreach going. So GVB and Guam Chamber of Commerce have been added to the effort, and so it's really great because they obviously have more staff than GHRA, who only has a staff of 4, and they actually have departments that do outbound calls at GVB with the marketing and market research departments. And so what we've also done is consolidate our membership listing between GVB, Chamber, and GHRA, because that would be a better representation of the private sector.
Mm-hmm. And so how many businesses, when you consolidate all of them, what are we looking at? Like, I know this says an estimated 800 businesses. Is that right?
Well, 800 is just Chamber's listing, and then GHRA's is about 300 plus, and then with GVB, I think it was about 600. When you consolidate it all together, the list was about 800.
Mm-hmm.
What about this, something in the press conference yesterday where the Admiral had said that there was some kind of investigation, a sailor break-in quarantine at the hotel. Is that something that you guys are involved with, or is that something that since the military is kind of policing everything that's on their end?
Well, the areas where I'm in charge of is the initial lodging requirements in getting all of the hotels ready. I'm also there during all of the transfers, and then any issues that come up on a daily basis, whether it's internet, Wi-Fi services, to the meals, to reports on what's going on. And so in this one particular case, in a hotel, the individual had tried to leave the room, and because they're not getting keys, it was noticeable that they were out of their room. And so we have Marine Corps on all of the floors, and so they were identified. So I think that because it is under investigation, I think the most important thing is that once they identified it and were able to get the actual video of that person exiting the room, that's now under investigation with the military. That person was immediately removed from the premises and brought back to base. And so we have various reasons of why they would leave the premises, but that was definitely only one incident, and it was handled expeditiously.
Well, so he managed to break out of the room, right? Because you said that you guys take the keys away?
It wasn't breakout. He opened the door. Yeah. And so I don't know for what reason he opened that door. He didn't break out.
So you don't know if
he just walked out. Okay.
You don't know if he left the hotel property and went gallivanting around, or maybe meet up with a girl. Or
he did not leave past that floor.
Okay.
So we have Marines on the floors and doing patrol. So, and then we have also military throughout the front desk area and command. We have a command center at every hotel and all of the exit areas. So it's very well staffed, manned, and patrolled on a regular basis.
What do you make of these? I think there was something the Admiral said about sailors who were in the hotel are now being tested and coming up positive. Is that accurate, Mary?
No, that's not.
No?
No.
That's not what he said.
Every day, the military are being screened twice a day. And so with those screenings, there could be times where, whether it's somebody who might have asthma or whatever the reason might be, at any time they show any kind of symptom, they are removed. We do not get reports on whether or not they're positive. That is not for our information.
Right.
We want to make sure everybody gets the medical care they need. And so we are not getting that report because of HIPAA especially. And so all we know is we've received more than, we only know the rooms we allocated, the rooms that were issued, and then what is remaining.
I see.
Okay, so the government is not privy to whether or not a sailor who tested negative and is in a quarantine hotel, whether or not they've since tested positive and removed.
I think
we're not given that information.
No, the government of Guam receives regular reports. Me in the command center and being in part of the command center task force team and in charge of the hotels, we are not releasing data back to any of us in private sector, and so that information is not necessary when it comes to our processes. We just need to know if somebody vacated the room.
Is there any anxiety on your part, though, knowing that how this virus is so insidious and that people could be asymptomatic or they could get the symptoms, quickly and then being taken out of the hospitals, maybe later testing positive? I mean, is there any...
Oh, yeah, absolutely. That's why all the preventive measures are there. The hotels, once somebody leaves, the command center, not the hotel, but the command center actually closes that door, closes out the room, and they double lock it. They've been given access to the master keys and from the hotels, and so they double lock it to ensure nobody re-enters back into the room. It's closed for the duration of the quarantine period and then closed for an additional 14 days. And so it's going to be quite a long process, and that's what's written in our contract to ensure that nobody has access to those rooms. And as you know, through anything that comes out from CDC or WHO, as long as these rooms are closed for 7 days, whatever is in there, the virus should already be dissipate. And so we're able to re-enter the room and decontaminate. So we're already going to assume the worst on the situation and treat it as such. But nobody can re-enter, nobody from the hotel can re-enter the hotel except for back of the house operations. So even if, let's say, that room was vacated on day 5, that room has to stay vacated the remainder of the quarantine period until everybody is out, and then it's already closed for another 14 days to allow 7 days for closure and then 7 days for cleaning from an outside source.
Wow. That's good to hear.
So, yeah, so we have reduced all of the risks down to almost nothing with regards to the facility itself and to our local people, to anyone who works in the hotels. The command centers, honestly, are the ones that are taking on all the responsibilities outside of the actual cooking of the food and delivery to the service elevators. Once it's in those floors and through the service elevators, that's where the handoff is taken, and everybody is wearing PPEs at that point. So contact is down to nothing, but exposure is minimal because it's being done in what we call green areas, where there's no access point to anyone who has potentially come in contact with the virus.
Wow, so it seems like you guys have really thoroughly put in these mitigation measures, and you're also very thoroughly following them.
We are following them, and I am there at the command center all day long. We usually have an 8 a.m. briefing, and we are there all day long and even through the night. If there are any issues, whether there are complaints on food or Wi-Fi or whatever, we are working directly with the hotels, and we're mitigating those issues on a daily basis. But all of the security and the actual protocols with regards to food transfer or even how the health screenings are conducted. Those are the times when, the military are really handling all that, as well as any trash removal or laundry days. That's all being handled by our command center. So we really need to consider there's a lot of military who are supporting these different outfits, and they come from different command groups from both, mostly Navy. We have one Air Force group. And so these are the men and women who are actually putting themselves at risk in the hotels on a daily basis. But even then, they all have PPE, and they know which areas are considered red, but they sanitize immediately after they've walked through those areas. So they're cleaning immediately after they walk through those areas on each floor.
Okay, that sounds
Yeah.
like
Hey,
you
that
guys are
was
doing a lot.
that was like a power 12 minutes there, Mary.
I just wanted to ask, so just real quickly, the Department of Labor Director Dave Della Sola, he was on our show yesterday, and he was talking about how they're anticipating at least 38,000 people to file claims for the Pandemic Unemployment Assistance Program and the Federal Pandemic Unemployment Compensation Program. And out of that 38,000, can you tell me what are the numbers for the tourism industry? The latest numbers?
Well, initially when we first started reporting, right, they had about 6,000, I believe, and we were, or 7,000, and we were close to 3,500. So that was about half at that time. It's a little too early to tell at this point what those percentages would be, but considering that the tourism industry makes up 35% of the island's population, I would expect between 35 to 50% of that. That would be my assumption based on just sheer numbers and how much we do employ during this time. And also keep in mind, although the hotels are operating, we are operating on a very skeleton crew, and so it's not like everybody is back to work. It's an skeleton crew just for the back of the house operations and some operations with rooms division and managing rooms, but it's going to be minimal. So just keep that in mind. The numbers between 35 to 50% is what we've seen so far of total numbers reported by DOL.
All right, before we let you go, any advice then to any tourism industry employees or businesses on how they can avail themselves of these benefits in terms of what they need to do?
Yes, GBB, GHRA, and Guam Chamber of Commerce are working diligently to get this information out to everybody. There's a real simple process with a rapid response email in notifying the Guam Department of Labor. There are forms that we will help guide you with, and so I think if everybody just works on that process, we can get you the support you need in a more efficient manner. But in addition to that, I know that there are some concerns about, this is now, but what about later with recovery? And so I'm a member of the Coronavirus Task Force group together with GDB. And so we have looked at recovery plans. So once we are able to flatten that curve and start working with our key source markets, please be aware that a lot of those recovery plans are on paper, and we would start implementing that. But at GBB, a lot of the departments are still in touch with their key source markets. If we were to start to activate that plan and work with the airlines to start flying again to Guam. But we need to make sure we flatten the curve first and really work in concert with GBB before those decisions are made, because the last thing you want is possible reinfection from these areas that might still have coronavirus as well. Right. So I'm on that group, as well as the Economic Advisory Group that's led by David John and Joaquin Cook. So we're discussing areas of importance with regards to private sector and some of the things that we can look at from a mitigation standpoint, where businesses can actually maximize their efforts during this time, kind of like with the SBA loans and the stimulus package, but also with regards to recovery and what's going to be the new normal, because as you can tell, it's going to take probably, at least a year, if not two, before we could really see our tourism numbers get back to the levels they were at. I think people are going to be more distinguishing when they come to making travel decisions. So we have to understand what shifts in the market will take place. And right now, military is the one that we know through additional exercises planned throughout the year. That is going to be, they also have a new normal in how they've handled the coronavirus with the USS Roosevelt. And so I think a lot of that needs to be considered as we plan ahead and we start identifying areas that we will be challenged with and how quickly we can respond and contaminate or contain things and learning from our best practices and some of the challenges that we've had along the way, both on the government side, the private sector side, as well as the military side.
Okay.
Well, thank you very much, Mary.
Thanks, everybody.
Thank you. Thank you for everything that you're doing and your
Bye.
people.
Take care and
You take
happy
care.
belated Easter.
Yes,
Okay.
you too.
Thanking
And don't worry,
everybody.
we got a commitment from Lieutenant Governor Josh Tenorio. We're going to redo Easter. What? He said we're going to redo Easter. I have a recording.
because I was in the task force hotel, so that would
Yeah.
be great to see my family.
Yeah.
Right, yeah. So we are. When all this is over, I'm going to hold him to it, and I'm going to get it on a Friday so we get a 3-day weekend out of it.
One big fiesta.
Right.
Yeah.
Or maybe on a Monday so we could do it on a Sunday and then have the next day off, you know.
There you go. That's
Okay.
better because
Yeah.
Sunday is always Easter.
Right.
So.
Thank you, Mary.
Thanks,
Thank you.
Mary.
Thanks, everyone.
Okay.
Okay, bye.
Be safe.
719, of course, Mary Rhodes from the Guam Hotel and Restaurant Association, very thoroughly
She's
laying
on
out-
it, man.
Yeah, she is. yeah.
is on it.
Good lady to get on the phone. 719, we got a couple doctors coming up the rest of the hour. And, well, we'll just keep it here. There's a lot of info. Also waiting to hear from David De La Sola, the labor director, who told me that they should be getting the amount for the PUA, the Pandemic Unemployment Assistance.
Is this the WBA? I think it's the wage benefit.
Yeah, it's
Amount.
For,
Wage
yeah,
benefit
there you
amount.
go. There you go. Wow. They got to hire you over labor. You got your acronyms down. 719, it is containing COVID. Good morning, Guam.
Try McDonald's oven-baked apple pie, wrapped in a warm